AI for business. Why it matters in the healthcare digital ecosystem. AI for business is no longer a future-focused concept reserved for large technology companies or research organizations. It has become one of the most important strategic tools in the modern healthcare digital ecosystem. For healthcare organizations, behavioral health providers, hospitals, urgent care networks, private practices, treatment centers, and healthcare-adjacent companies, artificial intelligence is changing the way decisions are made, the way patients find care, the way operations are measured, and the way organizations compete in increasingly crowded markets. When we talk about AI for business, we are not simply talking about software, automation, or technology upgrades. We are talking about a new layer of business intelligence. Artificial intelligence can help healthcare organizations connect information that is often scattered across websites, advertising platforms, CRM systems, EHR and EMR platforms, call tracking tools, patient engagement software, analytics dashboards, and operational workflows. Every one of these systems produces data. The problem is that most organizations do not fully use that data. They collect it, but they do not always connect it. They review reports, but they do not always see the full picture. That is where AI for business becomes powerful. It gives healthcare leaders a clearer view of what is happening across the organization. It can help reveal which marketing campaigns are working, which leads are converting, which service lines have demand, where patient access is breaking down, and where operational bottlenecks are limiting growth. In healthcare, where timing, trust, privacy, and quality of care matter deeply, intelligent systems must be implemented with discipline. But when used correctly, artificial intelligence can help organizations move faster, reduce waste, and make better decisions. The healthcare consumer journey has changed dramatically. In the past, many patients followed a more linear path. They needed care, received a referral, and contacted the recommended provider. That still happens, but it is no longer the only way people find healthcare services. Today, patients and families often begin online. They search symptoms, they compare treatment options, they read reviews, they visit websites.
They ask questions through search engines and intelligent search platforms. They look at insurance information, location details, service descriptions, social proof, and provider credibility before they ever call. This means that a healthcare organization's growth is no longer determined only by the quality of care it provides. Quality is essential, but visibility, messaging, website performance, advertising strategy, call center response, CRM follow-up, and operational readiness all play a major role. A provider may offer excellent care, but if patients cannot find that provider online, understand the services, reach someone quickly, or move smoothly through intake, the organization may lose opportunities before care ever begins. AI for business helps healthcare organizations understand this entire journey. It can analyze search behavior, ad performance, website engagement, form submissions, call recordings, missed calls, CRM statuses, appointment data, referral activity, occupancy trends, and revenue outcomes. Instead of looking at each piece separately, artificial intelligence can help connect the dots. This allows leaders to see not only how many people are reaching out, but where they came from, what they need, where they hesitate, and what prevents them from moving forward. This is especially important because one of the biggest challenges in healthcare growth is the separation between marketing and operations. Marketing teams are often judged by clicks, leads, rankings, impressions, and cost per acquisition. Operations teams are judged by staffing, capacity, utilization, admissions, appointments, billing, and patient flow. Executive teams focus on revenue, margin, brand strength, and long-term scalability. These priorities are deeply connected, but many organizations manage them separately.
AI for business helps bridge that divide. A marketing campaign should not be evaluated only by the number of leads it generates. It should be evaluated by the quality of those leads, whether they convert, whether they match available capacity, whether the organization can serve them well, and whether they contribute to sustainable growth. Artificial intelligence can help connect digital marketing activity with CRM outcomes and operational data, making it easier to understand true performance. For example, a behavioral health provider may have empty beds or open program capacity. In that case, marketing may need to increase qualified demand. But if a facility is full, the strategy may need to shift toward waitlist building, outpatient growth, brand visibility, or high-value service lines. If inquiries are coming in but admissions are weak, the problem may not be advertising. It may be call handling, insurance verification, follow-up timing, messaging, or operational workflow. Intelligent analytics can help detect these issues faster. In healthcare digital marketing, artificial intelligence also improves precision. Healthcare organizations must now manage SEO, paid search, social media, programmatic advertising, local listings, review platforms, website design, landing pages, analytics, call tracking, and conversion optimization. Each channel creates data, but not all data has equal business value. AI for Business can help identify which channels are producing qualified inquiries, which keywords are attracting high-intent traffic, which landing pages need improvement, and where advertising dollars may be wasted. In SEO, intelligent tools can help evaluate search intent, content gaps, competitor positioning, technical website health, local ranking patterns, and topic clusters. In paid advertising, machine learning can identify underperforming campaigns, wasted spend, audience patterns, and landing page issues. In content strategy, advanced analytics can help healthcare organizations understand what patients are actually asking and what information they need before making a decision.
However, artificial intelligence should never be used as a shortcut for generic healthcare content or careless automation. Healthcare content requires accuracy, empathy, and trust. A person searching for addiction treatment, mental health care, urgent medical support, or specialty services may be making a serious, emotional, and time-sensitive decision. AI can support research, structure, optimization, and analysis, but the final message must be guided by human expertise and ethical judgment. Patient access is another major area where AI for Business can create value. In healthcare, a missed call is not just a missed business opportunity. It may be a missed opportunity to help someone at a critical moment. Intelligent automation can support call centers and admissions teams by analyzing call recordings, identifying common questions, tracking missed calls, measuring response times, summarizing interactions, categorizing inquiry types, and identifying training opportunities. This does not mean artificial intelligence should replace compassionate human communication. In healthcare, especially in behavioral health and addiction treatment, empathy matters. People need to feel heard, respected, and guided. AI should support the human team by reducing administrative burden, improving follow-up, and revealing patterns that are difficult to see manually. When used properly, intelligent systems can turn patient access from a reactive function into a strategic growth engine. Data engineering is another critical foundation. Many healthcare organizations have a lot of data, but they do not have usable intelligence. Their systems may include an EHR, CRM, billing platform, call tracking software, advertising accounts, website analytics, spreadsheet reports, and third-party dashboards. The issue is that these systems often do not communicate effectively. Artificial intelligence depends on data quality. If the data is fragmented, incomplete, outdated, duplicated, or poorly structured, intelligent systems can produce misleading insights. That is why CRM integration, EHR and EMR connectivity, API development, cybersecurity, reporting architecture, and clean data workflows are essential. AI for Business is not simply about buying a tool. It is about building the right data environment so that technology can produce reliable intelligence.
For executives, this matters because leaders do not need more disconnected reports. They need better decisions. Artificial intelligence can help leadership move from backward-looking reporting to forward-looking intelligence. Instead of only asking what happened last month, leaders can begin asking what is likely to happen next, which markets are growing, which locations need support, which service lines have demand, and where operational constraints may limit growth. AI for Business can also help reduce administrative burden. Healthcare teams spend significant time on documentation, scheduling, follow-up, reporting, internal communication, prior authorization support, intake workflows, and repetitive tasks. Intelligent automation can help summarize meetings, draft reports, organize notes, categorize inquiries, support patient education materials, automate reminders, and help staff find information faster. These efficiencies can improve productivity and give teams more time to focus on patients and strategy. At the same time, responsible implementation is essential. Healthcare organizations must be careful with data privacy, patient information, algorithmic bias, transparency, compliance, and human oversight. Artificial intelligence should not be used carelessly with sensitive information. Chatbots should not provide inappropriate medical advice. Marketing content should not make unsupported claims. Machine-generated recommendations should be reviewed by qualified humans. Responsible AI for business is not a barrier to growth. It is what makes intelligent technology sustainable. The competitive landscape makes this even more urgent. Healthcare organizations are competing with local providers, national brands, private equity-backed platforms, hospital systems, telehealth companies, directories, and digital-first competitors. Visibility is harder to earn. Trust is harder to build. Cost per acquisition can rise quickly when campaigns are not managed with precision. Artificial intelligence changes competitive advantage because it rewards organizations that can learn faster. A healthcare business that uses advanced analytics to evaluate campaigns, improve patient access, understand market demand, personalize content, and align operations can respond faster than competitors. It can reduce wasted spend, identify opportunities earlier, and build stronger digital authority.
For Logix Group, AI for business is not about chasing technology for the sake of innovation. It is about building smarter systems that connect digital marketing, data engineering, CRM and EHR strategy, analytics, operational intelligence, and healthcare business growth. The goal is to help organizations understand where money is being spent, where patients are being lost, where demand is increasing, where operations are constrained, and where better strategy can produce stronger outcomes. The future of healthcare will be shaped by consumer behavior, governance, competition, and operational pressure. Patients will continue using digital tools and intelligent search platforms to find care. Healthcare businesses will need stronger digital authority, clearer content, better structured data, more consistent brand signals, and better patient access systems. Organizations that build responsible, strategic artificial intelligence practices now will be better prepared for the future. Ultimately, AI for business matters because the healthcare digital ecosystem has become too complex for disconnected decision-making. It helps organizations see the full picture. It can reveal where marketing dollars are working, where patient access breaks down, where operations need support, and where growth opportunities exist. Artificial intelligence is not replacing the human side of healthcare. It is giving healthcare businesses the intelligence they need to support that human side more effectively. For leaders ready to modernize, grow, and compete in the digital healthcare ecosystem, AI for business is no longer optional. It is becoming essential.